Welcome to this explainer. Today, we're putting on our senior compliance auditor hats to decode the absolutely critical foundations of healthcare fraud laws and operational billing integrity. Look, if you work anywhere near the revenue cycle, clinical documentation, or compliance oversight, you already know the stakes couldn't possibly be higher. We're operating in a highly regulated space where simple, honest administrative oversight can quickly snowball into a massive legal liability. So let's dive right in and explore exactly what it takes to keep your operations ethical, accurate, and completely audit-proof.
Here is our audit blueprint for today. We're breaking this down into 4 distinct modules: the core legal landscape, billing compliance essentials, education and ongoing training, and finally, comprehensive program takeaways.
All right, let's jump straight into Module 1, the core legal landscape and its federal boundaries.
Protecting patients and safeguarding public funds really boils down to our strict adherence to 3 major federal statutes. These laws are the absolute bedrock of ethical billing. They're designed to prevent conflicts of interest, stomp out fraudulent billing, and make sure that medical decisions are based purely on what the patient actually needs, not on financial gain. Let's break each of these down so we can really understand our specific risk exposures.
First up is the False Claims Act, or the FCA. From an auditor's perspective, think of this as a massive financial tripwire. The FCA creates enormous financial liability for anyone who knowingly submits false, fraudulent, or unsupported claims for federal reimbursement. Now, what's totally crucial to understand here is the legal definition of that word, knowingly. It doesn't just mean you intentionally committed fraud. It actually covers deliberate ignorance or reckless disregard for the truth. So, if you're submitting claims to Medicare or Medicaid without actively verifying their accuracy, you are operating right in the danger zone of the False Claims Act.
Let's move to the next key piece of legislation. The Stark Law, which is also known as the Physician Self-Referral Law, is uniquely dangerous because it is a strict liability statute. This means your intent, it doesn't matter one bit. If you refer a Medicare or Medicaid patient for designated health services, things like clinical lab services, physical therapy, or imaging, to an entity where you or an immediate family member hold a financial interest, you are in violation. That is, unless you meet a very strict, specific legal exception. It is an absolute, zero-tolerance policy for self-dealing.
Finally, we have the Anti-Kickback Statute, or AKS. Unlike Stark, which is a civil law, the AKS is a severe criminal statute. It targets literally any form of remuneration used to induce or reward patient referrals involving federal healthcare programs. And pay attention to that word, remuneration. That doesn't just mean a shady envelope full of cash. It means anything of value: expensive gifts, free rent, inflated medical directorship fees, or specialized favors. If the intent is to buy referrals, it is a criminal offense, and it carries the very real risk of prison time and being totally excluded from federal healthcare programs.
Moving right along to Module 2, Billing Compliance Essentials. Time to focus on operational integrity.
Our day-to-day operational goal is the flawless execution of accurate claims, robust documentation, and aggressive, continuous auditing. As an auditor, I'm always looking for systems that proactively prevent fraud, waste, and abuse, rather than just reacting to denials after the fact. And this requires everyone, from the front desk, to the coders, to the providers, to be perfectly aligned on the rules.
Which brings us to the absolute golden rule of documentation. I literally cannot stress this enough. If it isn't documented, it didn't happen. When I'm auditing a file, I really don't care what you remember doing for the patient. I only care about what is written on the page. Every single claim you submit must be backed by legible, complete, and highly specific clinical records. If that documentation is missing or incomplete, legally, the service did not occur. And keeping any reimbursement for it, that becomes a serious compliance violation.
To achieve clean claim integrity, you have to execute 3 non-negotiable elements on every single submission. First, exact ICD-10-CM diagnosis codes that reflect the patient's condition to the highest possible level of specificity. Second, accurate CPT and HCPCS procedure codes that match the exact services rendered. And third, strictly compliant modifier usage. You absolutely cannot just slap a modifier 25 or 59 on a claim to bypass an edit. The medical record has to explicitly support why that modifier is medically necessary. Okay, I need you to embed the number 6 into your brain. Why? Because there's a mandatory 6-year retention standard for all billing, coding, and audit records. Federal investigators and auditors like myself have a very long look-back period. If we ask for records from 4 years ago to validate a claim, you must be able to produce them promptly.
Failing to retain these documents is an immediate, glaring red flag. To really protect the organization, we can't just wait around for errors to happen. We have to actively audit against high-risk fraud, waste, and abuse, or FWA schemes. We're specifically hunting for upcoding, which is billing for a higher-level service than what was actually performed. We're looking for unbundling, which is taking a comprehensive procedure and billing its individual components separately to artificially inflate reimbursement. We check for billing for unrendered services, literally charging for things that never even happened. And we constantly monitor for duplicate claim submissions. Finding and fixing these things internally is always better than having a federal regulator find them for you.
All right, shifting gears to Module 3, Education and Ongoing Training Implementation.
Listen, training is absolutely not a one-time check-the-box event. It is a dynamic, ongoing engine. Our educational initiatives have to adapt to annual coding revisions, shifting payer requirements, and, most importantly, our own internal audit findings. Think about it. If we identify a pattern of modifier errors in Q1, our Q2 training needs to target that exact vulnerability so we can correct the behavior.
A truly legally sound training program follows 3 distinct, measurable steps. First, it starts on day 1 with an onboarding review of the Code of Ethics and Department Standard Operating Procedures. Second, it evolves into continuous role-based training, meaning the training a biller receives should look very different from what a physician receives. And third, and guys, this is the part organizations miss all the time, we must verify comprehension. We do this through post-tests, quizzes, and regular quality assurance sampling just to make sure the information actually stuck and is being applied correctly.
And that brings us to our final module, number 4, Comprehensive Program Takeaways.
The big picture here? Having a dusty binder full of policies sitting on a shelf is completely useless. True compliance requires proactive execution. It demands consistent screening of employees against exclusion databases, prompt corrective action the very second an audit uncovers an error, and most importantly, a culture of transparency, where team members actually feel safe reporting concerns early.
So, if you take nothing else away from this explainer, remember this. Compliance is not just the compliance officer's job. It is an everyday legal, business, and ethical responsibility that rests firmly on the shoulders of the entire organization. From the frontline staff all the way up to the executive board, every single decision you make impacts the integrity of our healthcare system, the safety of public funds, and the trust of the patients we serve.
I want to leave you with one final thought. Ask yourself, if federal auditors walked into your facility tomorrow, are you confident your documentation tells the right story? Like, share, subscribe to Decode Healthcare with Harshal.